So coming from, my diabetes clinic, I've been here in Toowoomba for 12 years now, and I'm staying here for a lot longer because my 5-year-old is starting in prep next year, so I'm going to be here for a lot longer, and so I'm here to stay. And while I'm staying here, I really wanted to get into research into diet. And the reason I was interested in diet is that a lot of the success stories I've had in my clinic is not based on the medications that I give my patients. And I try, like Anthony, really hard to guide my patients around insulin and tablets, all the things that I'm really well trained in. And it doesn't seem to work nearly as well as what I'm going to talk about tonight. And a lot of my inspiration comes exactly from that, my patients. They tell me stories that throw me off the path of my usual treatment, and I'm really inspired by the progress they've made, so I wanted to share some of those stories with you. And I've looked into the data, really dug deep into the basic science of the hormones, which is what an endocrinologist is, look into that, and some of the really interesting physiology as to what makes us healthy rather than what stops disease. So I think it's really about health focus, so that's what I'm going to talk about. So what to actually do. So no, it's not guidelines, I'm just going to tell you exactly what to do and what you're going to do tomorrow. So it's all about glucose levels, and we heard from Anthony that glucose levels in the blood being high, that's the definition of diabetes. But for the 280 people every day being diagnosed, there's another 280 every day who haven't yet been diagnosed. Okay, so for every one person out there with diabetes, there's another person who hasn't yet got their diagnosis. So we're particularly bad in Australia. That's actually one of the highest rates in the world of non-diagnosis of diabetes. So I encourage all of you to tell your families, if you do have diabetes, that they should be checking it out as well. So all of the diabetes concerns revolves around what happens if the glucose levels run high. So it increases your risk of heart attack, stroke. I did my diabetes foot clinic today and always feels very sad about the problems that diabetes can do to nerves in the feet. It causes kidney disease, and you get to meet me in the diabetes clinic. So that's, I like to say later today, not in my clinic. So it's not a good idea to have diabetes, but a lot of this diabetes can be reversed, and in the traditional training, we don't say it gets reversed, but I have certainly seen it be reversed, not through medication but through the lifestyle changes I'm going to talk to you about tonight. So if you are pre-diabetes, this idea that you're developing the onset of diabetes, and that's all about the insulin that we talked about with Anthony, you can end up with diabetes if you're not careful, but you can turn the clock back by some of the things we're going to talk about tonight. And I really wanted to focus in not on what you just do exercise, stop eating so much. That doesn't work as well as what we're going to talk. What I want to, kind of provide you some ideas tonight. So what am I going to tell you? So I'm going to give you the practical guide. I want to really make sure you've got something to do tomorrow that's a little different to what you might have done today. So the first thing, and this is the most important thing, is to forgive yourself. And my mother tells me, Sheila, try not to blame yourself if you can blame someone else. And the person I want you to blame is your mother. So, and all those mothers out there, and all those to-be mothers, I want you to know this, because this is what we could have done better when we were pregnant with our children. So this actually, if you have diabetes, if you have obesity, if you have troubles losing weight, this is where it all started, was before you were born. So what I wanted to tell you is this thing called epigenetics. So there's a good word, I want you to put that into a sentence tomorrow. Yes. Epigenetics talks about how you were born with these particular genes, and we all know about genes, but what epigenetics says is how you turn the genes into health or disease. And it actually happens all the way through our life, but it's particularly important when we're a fetus and in the first 12 months of our life. So what your mother ate during her pregnancy, the stress levels that she experienced when she was pregnant with you, and if she gained weight or if she was overweight to start with, actually modifies those genes and increases our risk of disease as an old person. So we call this the fetal origins of disease. And so if your mum did this, you might end up being a really obese baby, so macrosomia, and you might have seen in the news recently, was it in Ipswich, there was a kid, was it 5.7 kilograms? And it was promoted as a really healthy outcome. That's not a good healthy outcome. Or you could have a really teeny weeny baby. And if you come to my clinic, I don't know, recently, I take a fetal history. I ask you, how big a baby were you? Because this helps to tell me the likelihood of you developing disease in adulthood, or as an old person, really. So we know that when you're born, and either of these two situations, so if you're a big, round, juicy baby or a skinny, mini baby, you are hungrier. You are hungrier, and you actually already prefer junk food. You already prefer sugar. And your muscles, interestingly, when you're born in that situation, either as a skinny baby or a big, juicy baby, your muscles aren't as efficient right before you were even born. Okay, so your muscles aren't as big, but you've got lots of good fat. So that big, round baby has lots of fat in the middle already, and fat in the pancreas, and fat around the heart. And so what that predisposes to is all of these conditions that we're talking about tonight in terms of chronic disease. So you're much more likely to put on weight, even if you eat the same food as that skinny kid in your class. So you know all those skinny kids, they just get away with everything. It's probably because of what their mum did and what your mum didn't do. And so the other thing in here, I didn't put smoking. So there's high rates of smoking they talked about on the news today, about rates of teenage pregnancy and the smokers in our Indigenous population. That also is a risk factor for all of these things. So yes, you can you can blame mum. And what happens next? What happens next as we get older, and we're seeing this in younger and younger people, and in some of our Indigenous patients or people in our community, we're seeing diabetes have an onset as a teenager. Okay, so it's generational. So your risk of obesity, diabetes, high blood pressure, cardiac disease, cancers, depression, anxiety and dementia, Parkinson's disease, schizophrenia is all linked with what happens in utero. So yes, it is all mum's fault. And I tell my mother regularly this, but now my children tell me as well. So, and it's actually worse for women and worse for girls. Okay, so it's really quite worrying. So I think if you have anyone who's in your life who's pregnant, they need to hear about healthy eating, because it is reversible. They've actually done studies on carrot-eating mothers, and the kids all loved carrots when they were born. So I think I got it right with my fourth kid. I finally got it right. And so this morning, what did he have for breakfast? He pulled out a piece of celery out of the fridge himself and was gnawing into it. And so I thought, well, and I show my other kids and go, look, we did it right. Sorry, I mucked it up for you. And my son who's 13 said, Mum, the only reason I like Turkish delight is your fault. So anyway, so what can you do? So this is what we can do, and I think this is what I'm going to talk about, is what we can specifically do. So we've talked already about carbohydrate and sugar, because they will make us fat. And I suppose we just had a question earlier about, plant-based foods and vegetarian diets. We're talking about healthy whole foods. We're trying to cut out processed foods, and if that's one take-home message, I think that's worthwhile kind of taking that on board. I will talk about breakfast, and I know we talked already about fasting, but I want to specifically target breakfast. And I'm going to talk about strength exercise, and we talk about, mental health care. So if you have, this scenario, it's these very specific recommendations for us to kind of keep our health in good control. And if you do have a mother who did this to you, then it's important to be aware that you have a risk of those health outcomes, and we need to keep an eye out for it. Okay. So these are the key messages. So if you are overweight, and one of those things that, be kind to yourself, we don't want you to get skinny. In fact, we know that your mortality as a woman increases if your body mass index drops below 25 after the age of 55. So if you're looking at, big numbers, these observational studies, we don't need you to be skinny. In fact, it's better to have a body mass index, that's stable throughout life. But I think if you're wanting to lose weight, we're talking about 5 to 10%. So if you're 120 kilograms, that's 6 to 12 kilograms. That's taking you off the hook, really, isn't it? So I think I've got a lot of patients who feel like they need to be skinny, but skinny is not necessarily the outcome, it's health. And I think sometimes that's in great contrast to what my patients are wanting to achieve. So I need to reset that to say this is actually a good outcome. Okay, so we're getting into the actual how to do that. So you will not lose weight if you don't sleep. And we've done these studies where they've looked at weight loss diets, I'm giving you the weight loss. If you do not sleep, you will never lose weight. Even if you eat half the calories. If you're not sleeping, you're not going to achieve weight loss. Okay, so that's the first thing. So what I want you to do is to look at what happens if you don't get sleep. So all of the studies relate to sleep of less than 6 hours a night, and that's continuous sleep. That's not getting up to, kind of get to the kid or the barking dog. That's continuous sleep. So we know that the next day that you don't get a good sleep, you're much more likely to go to the sizzler kind of dessert bar than you are to the salad bar. And they've done those studies, they've done the sizzler study, and they've found that consistently everybody goes to the dessert bar, eats more calories overall, but it's the desserts they go for. We're actually more prone to having infectious diseases. So you're much more likely to get the flu if you haven't slept. You're much more likely to have unhealing wounds if you don't sleep. And we know that if you go, next time you get your flu injection, make sure you have a decent sleep. So won't go and get my vaccination until I've had 8 hours sleep the night before, because I'll only get 50%, half of my antibody titer, as a response to vaccination if I haven't had a decent sleep. So I actually hold off until I've slept properly. You're much more likely to have high blood pressure the next day, and for women it's worse. So high blood pressure is a result of poor sleep. We know diabetes. All of my patients will try and get them to sleep. If you're pregnant, I'll treat your reflux, so you actually get better glucose levels due to the sleep deprivation. And we know in the Nurses' Health Study, where they've looked at women over time on night shift, they're much more likely to have cancers, depression, heart disease, and the cancers, not just for women but men as well, but for breast cancer, bowel cancer, prostate cancer. So that's all sleep deprivation. And it all relates to slow wave sleep. So when you go to bed and you have a really deep sleep, like a really good sleep, your immune system's kind of repairing itself, blood pressure goes down, glucose levels go down, you kind of consolidate memory. So all of the good stuff only happens if you have a deep sleep. Not just closing your eyes, having a light sleep, a really deep sleep. Okay, so how do we do that? I'm aiming for at least 7 hours of sleep a night. If you sleep for more than 9 hours, it goes the other way, get poor outcomes. So you need to kind of, go for 7 to 8 hours of sleep, and we know that will reduce your blood pressure tomorrow and long term as well, and it improves immunity. And for children, if they're having screen time after 7 p.m, it impairs their cognitive function and memory tomorrow at school. So 7 p.m. is my deadline for my kids. Now my older kids just ignore me because I'm a sleep Nazi. And it improves your appetite control. So what do you do to get a good night's sleep? So I speak about sleep all day long in my clinic. So you do need to avoid the screens, and I think there's all these orange filters and all sorts of things that you can do. Now, not a lot of those are actually well evidenced, but I recommend having avoidance of screens for at least an hour, probably 2 hours. The warm shower is interesting. So the warm shower actually, because you radiate the heat in the shower, your core body temperature cools right down. So having a cool body actually gives you a better quality of sleep. That's why when you get the flu and you can't sleep because it's really hot. So cool body is a better way to sleep. And the different things to, prepare for bed. So, avoiding the heavy meal like we heard from Anthony, you're not snacking anymore, and not having caffeine. Now, coffee, tea, and interestingly, avoiding the daytime nap. So having a nap during the day interferes with the quality of the sleep overnight. So you try and hold off. And if you have, and the exercise during the day improves your sleep, but if you exercise really late at night, it heats you up, and so it interferes with slow wave sleep. And the sun exposure during the day seems to also play an important part to reset your sleep-wake cycle. All right. Now, I like melatonin because melatonin is the hormone that's switched off by the blue screen. So I should go back to that. So you're familiar with the blue screen idea, why screens are important? Yeah. What's interesting, when before screens were available, the blue light would tell us it's daytime, turn the lights off, or the sun would go down and we'd go to sleep. And it all relates to this melatonin, which is produced by our brain to help us get a really deep sleep. So then they invented screens, and better still, iPads. iPads are the perfectly blue wavelength just like the blue sky and switches off the melatonin just perfectly. So the wavelength of the blue light that comes out of your iPad or your tablet is perfectly matched to the switching off of your melatonin. So there ain't no deep sleep going on for you. So melatonin is really valuable. We use it, regularly in our clinic with great success. And we found that in our patients with diabetes, it actually improves their glucose, their HbA1c better than some of the other medications we use in our clinic. Antidepressants are also, so that a lot of the antidepressants can be helpful for that as well. But not alcohol. It actually interferes with slow wave sleep, and the Valium or benzodiazepines, which are the traditional kind of sleepers, they're terrible. They get you off to sleep, but then you miss out on the deep sleep, so they're just the worst in terms of quality of sleep. Does anyone have any questions about sleep before I keep going? Is there any? Yes, one question.
You mentioned about shift workers. Would you have any recommendations for shift workers?
So shift workers is a really good question. So there's actually a centre in Adelaide that's dedicated to shift work research. So what we've found in the shift work is we know that if you shift work, you can tolerate it better if you're an early bird versus a late night. There's all sorts of interesting things about jet lag around that. So I recommend when you are doing shift work that you don't eat on that shift if you can, but if you are eating, you don't want to be eating a lot of carbohydrate foods. And it just goes to the fact that carbohydrate does disrupt sleep-wake cycle, in this pathway as well. So we try not to. So if you're going to have, eating, you try not to, go for the chips. So, and then when you go home, I do, you need to, put your sunglasses on, make sure you're not getting exposed to that bright light so you actually get a deep sleep, through the day if you can. But it probably is, trying to stick with, regular meals rather than snacking for the same reason we talked about before, but getting a deep sleep when you can. But I think there's a whole lot of difficulties around, but you do need to aim for a deep sleep if you can, and I think melatonin to help you through that, can be useful in some scenarios, but it is a really challenging area. Other questions? Yes.
Is television classes a blue screen as well?
So the question is about television screen. Is it as bad as a computer screen? So the value of, the blue light is not just about the blueness, but it's also about the brightness and the distance. So the worst that you can do is a screen by your bed. The better you can do is a computer, and the best is probably a television. So the television hasn't got the same level of intensity of that blueness, so it probably doesn't have quite the same problem as a computer screen. But we'll have patients who actually get better glucose control if they switch the television off early, so they will get some benefit. Yes, and I must say, when I use, so Dr. Gillies, when I'm working hard at night time, I use melatonin myself. I actually feel better now, whether it's just psychological, I don't know, but if I'm using the screen, I'll use melatonin on those occasions very specifically, and I feel better. So, all right. So I'm not an exercise physiologist, but this absolutely is key to making you better. So we hear all the time about exercise and walking, and so we get told you just go walking. My patients don't get much benefit from walking, and in fact a better dose of health comes from strength exercise, and it all relates to the muscles and the efficiency of your muscles. So we know that exercise is good for fitness, it makes everybody feel good, it does improve rates of depression, anxiety, so we know that, there's some good evidence behind that, and it will reduce your risk of diabetes, so all of those are good. The thing that I often mention to my patients, so in my foot clinic today, if you can't walk because you've got problems with your feet or you're in a wheelchair, upper body strength, actually improves circulation for the whole body. So it's actually a whole body benefit that you get to your heart, to your brain, your kidneys, all of your body circulation improves with exercise, regardless of which bit is working. So, and I will talk about more specifics, but I think the point for me is the sitting is killing us, and it's the fourth highest contributor to disease in Australia. So smoking and obviously food, but sedentary lifestyle is actually a bigger contributor to kind of poor health outcomes than a lot of other traditional things we talk about, but sitting is the key. So if you're then thinking, well, what is better? So what is good for muscles? So we talked about being born with little skinny withered muscles. The best thing for muscles is to exercise and strengthen them. And there have been studies on standing. So if you just stand up in the ad breaks, and I tell my patients just stand up in the ad breaks, stand for 5 minutes, you actually improve your glucose control, your blood pressure for the next 24 hours just by standing. And if you get really excited, you stand up and sit down. So I've got my patients, we talk about bending, but you'd never do the bending right. So what we get our patients to do is to sit down on the couch and stand back up again. And the benefit, you can fall over and you fall onto your couch, but you've actually got a really good strength exercise just doing that. And if you were to do 3 sets of 6 bends like that, we know that that will actually build up strength and fitness and increase the cross-sectional area, the amount of muscle you have within 6 weeks. So we talk about that with patients. We've got people in wheelchairs that we bend forwards and backwards and do really simple things, and it's about strengthening those muscles, and it makes a big difference to glucose control for the next 24 hours. And I will explain interval training. So I can see some really fit-looking people in the audience who know all about interval training. Who knows what interval training is? What the heck is it? So interval training is just speeding up and slowing down. So if you just go for a walk tomorrow and go, okay, I'm just going to do this whole interval training thing. I'm just going to be in with the cool kids. So if you walk for, let's just say 30 minutes, if you just take a telephone pole and you walk faster in between each second one and you speed up and slow down, that's actually a more potent dose of exercise benefit than just walking the same pace all the way through. And you think, that doesn't sound right. But but it really makes a big difference. I'll show you why. So when I'm talking about exercise, I'm talking about mitochondria. You know what mitochondria are? So they're the energy parts of your cells in the muscles and in the liver. When you're old, this is what you turn into. Little mitochondria get all withered and sick and sad. And you're sitting around, that's you sitting there now, and your mitochondria getting a bit withered. We know that reduces all of your ability to actually process carbohydrate and be healthy, and it increases your risk of cardiovascular disease. Whereas if you have good, robust-looking mitochondria, they're really good energy powerhouses, that's improved specifically by this high intensity, this interval training idea, but also strength exercise, more so than just walking. And all of the benefits are all of the things about keeping you young, so reducing your risk of diabetes and improving your exercise capacity. So all of those benefits come from that. But interval training talks about on-off. And so what we're doing by giving this interval training is actually pumping up your mitochondria. So if you have these little mitochondria, every time you exercise, you activate the mitochondria, they pump right up. But when you rest in between, that's when they actually start building up. So you give them a bit of a burst of exercise, and then you rest, and then they recover. So you exercise fast and then you relax again, and you exercise fast and then relax again, and in between, every time you give them a burst of exercise, you're pumping up your mitochondria, but then you give them some time to relax and recover, and that's where the real health benefit comes from. So and I think going back to that the previous slide, I think it might be worthwhile, like we're talking about, getting some advice about this. I'd really encourage you to do that. I went and got a program, kind of a couple of years ago, and I said, I've got 10 minutes, that's all I've got every day, what can you give me? And they gave me this fantastic little program of high intensity interval training that, amazingly fit really quickly. So I'd really recommend that. And we know that it can improve your fitness 90%. So in 90% less time than if you just went walking. So you actually get fit super quick. All right. So eat breakfast. Now I know we heard about, you've got to fast and all those things, but no. If you have obesity or diabetes, a lot of my patients actually skip breakfast, they skip lunch, and then they have this fantastic JATS meal at about 3 o'clock in the afternoon, and then they go into dinner, and they just are desperately starving all day. Okay, so that's that starving idea. So if you're fasting, everything that you've got in your body is ready to store that carbohydrate and store that, the deep freezer we talked about, because it never knows when you're going to fast again. So you are in really good storage mode. So if you fast, and you're primed for diabetes, it's probably not the ideal way to go. So I'm going to talk about breakfast for a whole range of reasons, but I'm going to ask you guys, so which one did you fit into? So who in the audience ate nothing for breakfast this morning? A few people, yeah. We get busy, don't we? Who would have eaten cereal? And I did have cornflakes here, but so cereal. And who would have eaten more this kind of egg scenario? Oh, look at that, you're sold. So this is the better one, and it's not just about what we're talking about, carbohydrate. I find it really interesting. If you want to be smart, eat something. So they've actually done these studies, big studies, looking at what happens if you don't have breakfast, what happens if you have cereal for breakfast, and this is just like the little kind of score system. So the smarter people at this end, and this is where the cognitive function or the kind of brain testing went really badly. So if you had no breakfast, your ability to perform these brain tests were really poor. If you just had cereal, it was not much better. You're starting to get better if it's starting a low glycemic index, kind of a carbohydrate idea. But if you're having protein or having fat, this is where the smart people are living. So I've just given those examples, but it was actually just moderate fat in the yellow and protein in the blue. So I think that it goes back to putting those big logs on the fire to help your energy burn better than the kindling we talked about. So we know that if you just eat a healthy fat and protein, and I'm not saying don't have all the carbohydrate with it, but it's just looking at what macronutrient sets you up for the day. So it controls your appetite. It actually switches those hunger hormones straight off and it keeps them off for 6 to 8 hours. Whereas breakfast, if you have cereal for breakfast, you get this rebound hunger hormone response in about 2 hours. So not only were you hungry, but you're hungrier than before you had your breakfast. And that sets you up all day long for this roller coaster. And you're less likely to snack as a result. I've got one lady who lost 6 kilos in 8 weeks because she ate cheese for breakfast. Instead of skipping breakfast, I said, just have some cheese for breakfast, just for fun. And she said, I gave it a go, and she lost all this weight. She said, I actually don't feel hungry. And I said, yes, you're right, it did work for her. So she actually achieved weight loss just by that. And we know that cognitive function, and we know that if you've got diabetes, your glucose levels will be improved by having a healthy protein breakfast. And for women, it will lower your blood pressure. So if you skip breakfast, women have a higher blood pressure, and that's been kind of proven in a number of different studies if you skip breakfast. So it's worthwhile considering a change in maybe what you might choose. I'm not saying you have to eat this, but it's just an example of protein or fats for breakfast like we talked about. Now I can't go past this. I love talking about sugar, and we've heard about snacks. I just want to actually share an experience. My daughter, just went over for an exchange thing in France just recently, and she said over there the television, the ads are constantly saying don't snack. For your health, don't snack. It's a constant message that seems to be culturally appropriate over there, whereas here, don't snack, it's very moralistic. But I thought it was really interesting. Culturally, I think we've got a lot to, maybe learn from other cultures. So here's some little fun facts. So if you have 1 can of soft drink every day, that's about 7 kilograms in a year. You don't necessarily lose that weight by not having the can, but we don't know that, and these are little things to I find are really useful kind of take-home messages. And you might go, but Sheila, what about artificial sweetness? I don't have full Coke, I have non-sugar Coke. The problem with non-sugar or the artificial sweetness is that it's a little sugar molecule that they've switched, and actually plays little games with your gut microbiome. The bacteria really go bananas, and they really don't let you lose weight. So in fact, they've found that artificial sweetness promote weight gain because it switches on the sweet taste receptors in your gut and makes the fat grow. And it's the visceral fat, that inside your belly fat. It increases your risk of diabetes. And if you just think, just a little bit will be good, the cola, the caramelization of cola actually causes kidney stones and renal disease. So it actually promotes kidney disease. So it's not a good story, I'm afraid. And if you do want to eat sugar, so I know that you're not going to eat sugar anymore. Of course you're going to eat sugar. So I want to tell you how to get away with it. So I've got a lot of patients go, but Sheila, can I just have some sugar? And I think any time I say don't eat sugar, they'll eat more sugar. So I want to sugar smart, so how to get away with it. So of course less is better. So I've got patients who instead of having a big bag of Sandboys chips, they have a small bag of Sandboys chips. And that makes a big difference. So, you know, and I count potato in with sugar as well, like we heard earlier. And it's actually worse for your teeth than actually just having sugar, interestingly. So potato gets in underneath the gums and actually causes your teeth to rot better than anything else. So chips are really bad for teeth. So if you're going to eat your chips and you go, Sheila, I'm going to have my chips, eat it in the middle of the day. So the hormones that make you have high sugars and weight gain are really perfectly primed for dinner time and breakfast time. So if you, and this is worse for women, so as we get older, women absorb fructose, like we heard earlier, really, really well. So we absorb fructose and turn it into fat better than anyone, and it's worse as the day goes on. So if you have your fruit at night time, so you know, you kind of tin peaches or whatever, that's fat ready to go. Whereas if you have that in the middle of the day, you can get away with it because your hormones are not primed for fat gain. So it's a little sneaky thing. So if you really want it, middle of the day is the way to go. And don't have it on its own. So if you're having your pineapple and you just want to sit down with a bowl of pineapple, have it immediately after your meat, because the meat or the protein seems to regulate the way your body can actually absorb and process that carbohydrate. So if you have the meat or protein first, you then have the fruit or the sugar after it, not on its own. And if you really want to get, you know, kind of avoid that awful tired feeling that Anthony mentioned earlier, if you exercise within 30 minutes of that naughty whatever it was, it will actually offset that inflammation in the body after you've had that, you know, kind of bowl of pineapple. I'm not saying pineapple's bad, but if you're going to have that really big, you know, bolus of sugar, there's some little sneaky things that kind of offset that. So eating sugar at night will cause you to gain weight. Whereas if you have sugar during the day, it's less likely to cause that. And if you have sugar at breakfast time, like we said, your brain's not going to work, so you're going to be done for the rest of the day. All right. So I know you think I'm crazy, but brush your teeth. And I actually teach people in my clinic how to brush their teeth, because people are very emotional about their teeth. They're very nervous about me talking about their gums and their teeth. So the thing about teeth is the bacteria that you have in your intestine live in your mouth and under the edges of your gums, and that's what sets you up for inflammation and diabetes and weight gain. So we've found that if you have diabetes and you just go to the dentist once a year, your glucose control measured by HbA1c on average drops down by 1%. So I tell my patients, if you can't do anything else, just go and visit the dentist. And I instruct them to get the really soft toothbrush and brush their gums as well as their teeth. And my 5-year-old taught me how to do it. You brush and flick and all sorts of things that you do, but you brush your gums down and brush them up. And by improving the gum health, you actually will improve the inflammation in the body, and it makes a big difference. So for those of you who just go, I need to go and get some Listerine, you don't need that. Just salt water, and you just kind of wash your mouth out with warm salty water. And if you've got blood in the water, that's okay. That's actually improving the gingivitis, so it's not a bad thing, and you just persist with it. So we often start with that with our patients. So this is the last slide. So blame your mother. Your weight loss, you know, if that's what you're aiming for, you need to be kinder to yourself, and their aim is much gentler. We know that health benefits come from 5 to 10% of weight loss. I want you to go to sleep, so please go and have it, chuck that screen away, have a warm shower, head off to bed. And if you can't do that, meditation has been shown to improve slow wave sleep and actually markers of inflammation just as well as if you can't sleep. So if you can't sleep, go and learn to meditate. I can't do it. Anyway, strength exercise and this high intensity or just interval training is actually really important, and you just get benefit maybe from just 5 minutes a day. It's just as effective, but do it and do it really well. Interval training, brush your teeth. And of course, at the end of the day, I want you to be kind to yourself. Okay, I think we beat ourselves up by doing the wrong thing and feeling guilty. I think it's time to just be kind to yourself and let yourself off the hook.
Blame your mother.
And blame your mother. So I love that. So it's never too late to become what you might have been. And I think that's a really nice thing. So I talk to our patients at any age and say, you can do this, I have faith in you. And I've got faith in you as well. Thank you.